Okay, we're going to now start with the treatment. I'm going to have the machine turned on through the rocker. I'm going to place the applicator firmly on the tissue, and I'm going to hit the button. Now I'm going to give you some advice ahead of time. I've used saline solution and a coffee filter. The saline solution typically is cooler than what your skin tissue is. This machine is calibrated to operate at human temperature, which is usually about 98.6. So when I first put this saline solution on this area, this could be quite cold. So if I start off and you're not getting the machine to operate in the manner which you expected, it's probably because this area is too cold. So sometimes I'll take it and hold it to get it to be warm. So I'm going to place this down, hit the button. We have an audio with the machine, which gives you the ability to monitor the use of the machine and the temperature without looking at the display. If you listen to the sound, it is gradually increasing in pitch. If you look at the numbers, as we're increasing in temperature. What you want is that gradual, you want a steady climb. If you hear now, it's beeping, because what we've done is we've reached treatment temperature. It's going to beep 15 times, once every 2 seconds. And then at the end of the 15 seconds, you're going to hear one long beep. So what's nice about this audio is you don't have to be looking at the display. There's long beep, I turn it off, and I lift it up. That's how you do the treatment. So now I'm going to do another one. I'm going to put this down here. I'm going to push it. And again, you want to hear that gradual incline of the sound. If by chance it's not climbing in a higher pitch, you probably have this area too cold. So sometimes I'll do this to kind of force it to kind of get a little bit warmer, or I've even held it to squeeze it for it to get warmer. In addition, another challenge you have if you're not climbing at a right temperature here is because you're not getting enough conductivity. So what you needed is it was not wet enough. You did not have enough saline, or an example of the tissue of the body is if you had a lesion that's dry and crusty and that RF has a difficult time in penetrating the tissue, you're going to have what we just occurred, which is that long pitch that is just kind of being held. You always want that gradual increase in sound and temperature. So we could start again. I'm going to push down, I'm going to activate. Notice when I added a little bit of warmth by holding it, you had the increase again. Now, you will not have as much of these temperature issues with true skin tissue. Again, it's going to climb to the desired temperature. When it gets there, it's going to stop. It beeps for 15 beeps, and then you're done. So that is how you would just continue to treat until you have that area covered.